All right, let's talk respiratory assessment, chest and lungs. Are you ready? All right. So, what is the HPI? Like today, present, history of present illness. Okay. So I'm asking questions about, hey, what brings you in today? So that means I already did their chief complaint, and let's say that their chief complaint was just, oh, I get short of breath. Like, okay. So let me ask you some questions about that. That's your HPI, history of present illness. All right. When did it start? Does it happen in the morning or the nighttime? Now, what kind of diseases have morning time cough and respiratory distress? Yeah, COPD does. So COPD is usually in the morning. Seasonal allergies or allergies, usually they wake up and that's because they've been laying down all night. All that mucus is gathered, and then when they wake up. Nighttime cough is asthma. Asthma symptoms happen at night. Good. Sputum characteristics. What does it look like? Because if they're like, oh, it's super bloody, oh no. Okay, but if they're like, oh no, it's clear or whatever, we kind of need to know what it looks like. That can also tell us like if it's like a rust colored, usually that means it's pneumonia. If it is a pinkish color and it's frothy, pink frothy sputum, that's pulmonary edema. So I need to know, what does your sputum look like? What triggers the cough? And they're like, oh, it only happens when I smoke weed. I understand now. Okay. So you always want to ask, like, is there something that makes it worse? Because if they say like, oh, every time I go and mow the yard, well, that tells me it's probably allergy related, right? And then what makes it better? Do you have to sit up? Do you take cough medicine? Like, what makes it better? And that'll usually kind of tell me where the cough is coming from. All right. What does associated symptoms mean? When you see that on a chart, that means other symptoms that go along with your chief complaint, because nobody's ever just going to come in with one chief complaint, right? Like when you get sick, like let's say you have flu-like symptoms, right? And they say, well, I can only take one chief complaint. What is it? And you're like, oh, okay, I have body aches. Oh, okay, well, what else do you have? Those are your associated symptoms. Oh, I also have fever, chills. You see what I'm saying? So associated symptoms are in addition to. Okay. All right, so fever and chills, I need to know that, because if you got fever, chills, and cough, what is that disease usually? Fever, chills, and cough. It's probably pneumonia, right? Pneumonia has fever, chills, and cough. If you've got cough and weight loss and night sweats, we know that's not a good combo. What disease is that? And cough. That's what you just said. Tuberculosis. I'd worry about tuberculosis. If they have a major cough and wheezing, what disease is that probably? Asthma or COPD, depending on their age, right? If they've got chest pain and cough, that could be a lot of different things. That could be pneumonia, that could be cancer. I mean, that could be like a million different things. Pleuritis, okay? All right, we always want to ask about their PMH. What's PMH? Past medical history. So remember, every time we're going farther and farther back, you start with chief complaint, give me one thing. Then I'm going to history of present illness. Now, what other, I need to ask some more questions. And then what other symptoms do you have? That's your associated symptoms. Then I'm going to go even farther back, your past medical history. 10 years ago, have you, So I want to ask if they've ever had any hospitalization or surgeries, especially if it's recent. Because if you've just been in the hospital and had a surgery, you're going to be at major risk of post-op pneumonia. Do you use CPAP or BiPAP? What disease is that usually uses that at nighttime? Sleep apnea. Do you have a COPD history? I need to know that. And then, have you been vaccinated against the big three respiratory, which would be strep pneumo, influenza, and or COVID? Okay, now I'm going to go even farther back. Tell me about your family history, 1948. Okay, so you see, every time we go farther and farther back. Yes? So in family history, allergy, asthma, and AD is atopic dermatitis, which is eczema. Those three, remember, always go together. Those are a triad. Okay? Do you have a history in your family of cystic fibrosis? Because that's genetic. I need to know that. TB, highly contagious. So I'd also want to know, like, if your husband has TB, I'd probably want to know, because you come in with cough and bloody cough or something, like I need to know. Family history of emphysema. Now, there is one genetic type of COPD or emphysema, and you could have never smoked a day in your life, and it's very early onset COPD, like in your 30s. Okay. Do they have any clotting disorders? Because I would worry about like a pulmonary embolism. right? And is there a history of any cancer in the family? Because we know that cancer, even though it's not genetic, it does tend to be familial, some of them at least. Okay. Let's look at the social history. So I want to know, what are you doing in your life that could lead you to have some lung problems? Okay. Why do you want to know where they work? Nosy. Sure, if I work in a mine, or what if I'm a carpet cleaner, or I work at an oil refinery, someplace where you're constantly exposed to breathing in chemicals, I need to know that. What's your home environment like? Does anybody smoke in the home? Right? If they live like in a crowded apartment complex, or maybe there's mold in their apartment. I see a lot of those type of posts like on Facebook and things like that, right? Their nutrition status. Why is that important for chest and lung assessment?
Are they getting like the right nutrients?
Because if not, they're at higher risk of infection if they don't get the nutrients, right? Exercise tolerance. I'm like, hey, you start running and 2 seconds into it, you can't breathe. We have a problem. Okay. Why am I asking about their hobbies? Also nosy.
People like for hobbies like they do stress relief.
Could be, yeah, okay. But I want to know, like, what if their hobby is spelunking? They go into caves. And they just dig around in caves. Okay, I need to know about that. Like, what are your hobbies that could lead you to have chest and lung issues? Okay. Why am I asking about recent travel? That's a big question to ask for which disease? TB. Tobacco and alcohol use, that's a given because we're talking about lungs. And then do you have a history of sleep apnea? Because obviously that causes major lung issues as well. All right. Red flags. Let's see what you know. You ready for your quiz? You might want to jot these down. Okay, just in case you don't know them. If you know them, you don't have to. All right, red flags. So that means if your patient starts to complain of this, you're like, oh no. Okay, and we'll talk about why it's a red flag. All right, what is hemoptysis?
Blood.
Hemo is blood. So
That's not it.
we're on chest and lungs. If that helps you.
Bloody
sputum? Bloody cough.
Bloody cough.
So hemoptysis is bloody cough, and you may see that mostly in tuberculosis or in skin cancer. Nope. Let me start again. Lung cancer. Okay. All right. Chest pain. If they're having lung symptoms and also chest pain, what could be wrong with your patient?
Like a cardiac or like a peripheral issue?
No, it would be like pneumonia has chest pain. End-stage lung cancer, like we didn't catch it early. Pleuritis has chest pain. All right, what about cyanosis? What does that tell me?
You're not getting enough oxygen.
Right, you got hypoxia. A blue patient is never normal. All right, what is orthopnea?
Is that where you have trouble sleeping? Up?
You have trouble. Oh, yes. Okay. So PNEA means breathing. So you can't breathe lying down. That's what orthopnea is. You cannot breathe lying down. And these are usually our heart patients or like they have pulmonary edema. There's a lot of fluid that's going into their lungs. And so the farther back they are, they're like drowning. So they have to sit up. And what's the one question that you ask to determine the degree of orthopnea? Like, how bad is it? How many pillows do you sleep on at nighttime? That's always on exams. All right, your patient comes in with red flag of fever and night sweats. What's wrong with your patient? TB, sudden weight loss. TB. What's HRT? If they've been on long-term hormone replacement therapy, that's a huge risk for breast cancer. Okay. Because estrogen causes cancer. We know excess estrogen causes cancer. Okay. If they are on a beta blocker, what's the big red flag for lungs?
With a new cough.
Because non-selective beta blockers cause wheezing and bronchoconstriction. So you always want to check and see. And the non-selective beta blocker is propanol. Yep. Clubbing. What does that tell me? Chronic hypoxia. Sudden onset of shortness of breath in pediatric patients. Like they're just chilling, they're playing on the floor, all of a sudden. What's wrong with your patient? Let's say they were on the floor just playing with Legos. And then all of a sudden.
Like they ate something?
They foreign body ingested it. It got sucked into their airway. Okay. All right. Key points, other things to remember is do not listen over clothes because you'll hear the scratching. And if you are going to go under the clothes, make sure the clothes are not touching the back of your stethoscope because it'll make that scratching noise. Okay. And you have to inspect their entire body. A respiratory assessment is not just lungs because your blood goes everywhere. Okay. All right. In pediatrics, big things to note. Do they have a history of prematurity? Because premature babies have very immature lungs because they lack, starts with an S.
Oh,
What do preemie lungs lack that causes major lung issues? Surfactant. It's surfactant. So surfactant is the WD-40 of the lungs. And when newborn baby or premature babies are born, they don't have that WD-40 of the lungs. Their lungs just stick together, which is what gives them such bad respiratory distress. Do they have a history of chronic lung disease? I definitely need to know that. Okay. Long-term steroid use or even short-term steroid use, because if you go back to, try to remember to OB, when mom's going into labor and her steroids to make sure that it matures the baby's lungs. So I want to know, did that happen? Okay. And then did they get their vaccines, influenza and pneumococcal? Okay. Do they have a history of, and these are major pediatric respiratory illnesses. I'm not going to cover them in detail because actually we're covering this, I think, next week. But bronchiolitis is like baby bronchitis, cystic fibrosis. Tracheomalacia is where their airway is very floppy, so they make a noise. Okay. Diaphragmatic hernia is when there is a hole in their diaphragm, and so all of their intestines will shove up into their chest cavity. So when you listen to their chest cavity, you actually hear bowel sounds, and it squishes their lungs to be like teeny tiny. Okay. And then croup, you probably heard of croup, right? And then do you have a history of GERD? Same as adults. Okay. Because GERD in kids, they can have that stuff come back up, and then they can aspirate it, and then that acid and food goes into their lungs. Okay. Remember in pediatrics that the respiratory rate varies, and you have to count for the full minute because they breathe like, okay. Don't make me cough. I don't want to be a baby. All right. They have a very rounded chest until they're 2. You've seen little babies. Okay, so their chest is super like just rounded. All right. And they will usually have bronchovesicular breath sounds. That's all the time. Adults don't. Okay. All right. Let's talk about things that would be abnormal in chest and lungs. Okay. Asthma. What is asthma caused by?
Like a trigger,
Allergic response. What is atelectasis?
That's like the sticking.
Yeah, the bottom of their lungs sticks together or partial collapse. What is bronchitis?
The bronchioles are irritated.
Yeah. So they'll just have wheezing and cough and things like that. Pleurisy and pleuritis are the same thing. So itis means inflammation of the pleural lining. So when they take a deep breath, it's very, very painful because that pleural lining rubs. Okay. What's a pleural effusion?
That's when
Anytime you hear the word effusion, it's one pocket of fluid, and it's outside the lungs. Okay. If it was inside the lungs, fluid inside the lungs is pneumonia, right? Yeah. So pleural effusion is outside the lungs, but still kind of pushing on the lung. What's an empyema? Pus in the lungs. And then all that pus can form together and form a big lung abscess. Okay. Pneumonia, obviously that's a big red flag. If you see fever, chills, chest pain, golden triad. Tuberculosis, they usually will have night sweats, weight loss, cough. Now the cough starts as dry. It will progress until it eventually gets bloody. All right, cancer. Now remember, cancer doesn't hurt, and there's no signs of lung cancer until it's late, and then they again will have hemoptysis. What's a pneumothorax?
And that's when one of them,
Yep, a collapse of the lung due to air, because pneumo is air. What's a hemothorax?
That's when it's like punctured.
So the lung is collapsed due to a collection of blood in the chest cavity. What's a PE? Pulmonary. No, you're right. I just said it stupid. Pulmonary embolism, which is a blood clot in the lung. Epiglottitis. What's the epiglottis? Yep, the little floppy part right over your airway. And epiglottitis usually happens in infants and children, and it is a red flag emergency because it's the floppy part over their airway. That's bad. All right, you understand the basics? Let's move on.